When you're a patient and you walk through that door and you're thinking about what you have to go through, the one thing we want you to remember is that we've put a lot of thought into this building, into the facilities, and into the staff. You're gonna have nothing to worry about when you come in.
Rather than queuing up at a big, hulking reception desk, you're given an RTLS device, which is a real-time location system device, and you're asked to sit wherever you'd like.
A unit of the system will come to them, sit down next to them, and check them in using a tablet.
Fox family, they're ready to see you now?
And what the RTLS system allows patients and caregivers to do is wander freely.
This is going to be great for figuring out where everybody is at all times and for communication.
Good, yeah.
You don't take any medicines for it?
You'll meet an anesthesiologist in the pre-op holding area, and we will discuss with you what your anesthesia plan is, what you might be able to expect.
And then their pre-op nurse, who's been with them for a couple of hours and has gotten to know them, will actually escort them right to the operating room so that they'll be with someone familiar right up to the minute that they walk into the operating room.
We have all of the latest state-of-the-art surgical equipment, including the newest surgical robots that are available. Everything in the room has been designed to produce the latest in surgical techniques.
You are the most important person in the room at the time, so everyone is interested in maintaining your comfort. You'll have a warm blanket put on you, and then before you know it, we'll tell you, take a nice deep breath, and you'll be off to sleep. Are you comfortable?
Yes.
What we're also including in the building are status boards, so that at any moment in time, as the patient is in surgery, families can go check the boards to see where they are in the process.
We're the first ones there when they're waking up, asking the questions about how it went. And when it's positive news, it's so great to be able to give the patient that news.
So for the first hour or two, which would be the same as being in a recovery room somewhere else, patients will be on a monitor. And then once they reach the point at which they would have normally been discharged from the recovery room and transferred upstairs to a regular room, we take the monitors off and they stay in place.
All of our extended recovery patients will be on a pathway, and their families will actually be encouraged to participate along with them so they know at what milestone they're expected to be. We'll have in the room a board that they'll be able to see at each hour. So at hour 1, you should be awake, you should be feeling better, your pain should be managed. At hour 2, you might have to sit on the side of the bed. Hour 3, you may be out walking alone or with your family, just depending on what pathway you're on. And there are different pathways for different types of surgery.
When's your family coming?
We've created what we're calling an oasis in the center of the unit.
We're also going to be having like a continental breakfast in the morning there, which is pretty amazing because it's going to help the patients get out of bed and start that recovery process that next morning to get them home for discharge.
We're actually going to use video conferencing so that the surgeons can check in with them in the morning, answer any questions, and have them ready to go as soon as they're ready to go home. They don't have to sit around and wait for the surgeon to get here to have a conversation with them to go home. We don't want our patients to wait.
And I think making them happy to go home and have a good patient experience is the real goal here.
Once they go home, we really want to know in detail how they're doing. A lot of patients just don't know what's normal. When they don't know what normal is, they get very anxious. So we'll be able to reassure them how they're doing compared to how we think they should be doing.
We're all about the patients, and the patients come first, and we want to design the ultimate patient experience for you.
From the moment the patient walks into the door, I think they're going to have a really unique experience here, and I'm really proud to be a part of that.